Top 10 signs of high blood sugar levels. Hyperglycemia, or simply high blood sugar, can be life-threatening if left unchecked. Because the body lacks enough insulin, hyperglycemia, high blood glucose, occurs when too much sugar is in the blood. Hyperglycemia, which is linked to diabetes, can result in vomiting, extreme appetite and thirst, a quick heartbeat, eye issues, and other symptoms. Hyperglycemia, if left untreated, can cause major health complications. Hey everybody, welcome to Boost Healthy, the video channel to live healthier and better. Today, we look at the top 10 signs of high blood sugar and when you absolutely have to call the doctor. Number 10, weight gain. Weight gain is a sign that the insulin is working, that your body is better at utilizing sugar, fat, and protein, and that it can store nutrients. When your blood sugars are high, your appetite usually increases. This symptom characterizes diabetes. Food consumption should be modified to maintain the same weight after your body is better at utilizing nutrients and storing them. If you're trying to reduce weight, you'll need to make further changes. If your food consumption, both quantity and varieties, is not modified, you can expect to gain weight. Your body has a better chance of rehydrating when you manage your diabetes, leading to mild weight gain. Dehydration is, of course, a more considerable risk if you have diabetes. Frequent urination and thirst are two common signs of the condition. You may gain weight while using medications for other problems. Number 9, increased thirst. Diabetes symptoms and indicators include excessive thirst and frequent urination. Excess glucose, a form of sugar, builds up in your blood when you have diabetes. Your kidneys are forced to work overtime to filter and absorb the additional glucose. Polydipsia is the medical term for excessive thirst in diabetics. Diabetes mellitus and diabetes insipidus both have this problem. When your blood sugar levels are too high, you get diabetes mellitus, which comprises both type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune condition in which the pancreas stops producing insulin, a hormone that enables blood sugar to enter cells. Type 2 diabetes is caused by a lack of insulin production or poor insulin use. Your blood sugar levels have no bearing on diabetes insipidus. It is an uncommon condition that affects your kidneys and the hormones that keep them running smoothly. Diabetes insipidus causes your body to generate a lot of urine, which leads you to be dehydrated. Number 8, increased eating habits. One of the three main indications of diabetes is polyphagia, a medical word for excessive hunger or increased appetite. Polyphagia can result from more severe disorders such as melancholy or stress, but it can simply result from everyday things like intense exercise or other rigorous activity. Because glucose from the blood cannot enter the cells in uncontrolled diabetes, hyperglycemia, the body is unable to turn the food you eat into energy. This is due to either a shortage of insulin or insulin resistance. Hunger increases as a result of the lack of energy. In those with controlled diabetes, simply eating will not alleviate the hungry feeling of polyphagia, as this will only add to the already high blood glucose levels. Exercise is the best strategy to lower blood glucose levels since it stimulates the insulin production and lowers blood sugar levels. An abnormally low blood glucose level might also increase hunger, hypoglycemia. When blood glucose levels drop below 4 millimoles per liter, the body responds typically by releasing stored glucose from the liver to restore normal glucose levels. Number 7, constant urination. If you discover that you're peeing a lot or urinating more frequently than usual, it's conceivable that your frequent urine is an early indicator of diabetes. However, there are a variety of explanations for frequent urination, some of which are entirely safe. It's critical to understand the link between diabetes and bladder function and other warning indicators that suggest you should visit a doctor about your frequent urination. When your kidneys can't keep up, the excess glucose is excreted into your urine, dragging fluids from your tissues and making you dehydrated. This will usually leave you feeling thirsty. You'll urinate even more as you drink more fluids to quench your thirst. Too much sugar in your blood puts a lot of strain on your kidneys, which work hard to digest. When your kidneys aren't up to the task, a large amount of glucose is excreted in your urine. This process also removes vital hydrating fluids from your body, leaving those with diabetes thirsty and peeing frequently. You may not even realize you're urinating more frequently than usual at first. However, if frequent urine begins to wake you up from sleep and drain your energy levels, it should be one of the primary warning indicators. Number 6. Chronic fatigue. One of the most prevalent symptoms of elevated blood sugar is fatigue. Diabetes fatigue is a term used to describe how people with diabetes feel. Many people with the illness are constantly fatigued, regardless of how well they sleep, eat, or exercise on a regular basis. According to studies, up to 61% of persons newly diagnosed with the disease report weariness. Fatigue, on the other hand, is not limited to diabetics. It can also happen to people with normal or pre-diabetic blood sugar levels if their blood sugar levels surge suddenly. When blood sugar levels rise, the body goes into overdrive, seeking to produce enough insulin to restore balance. If there isn't enough insulin or the body doesn't respond to it properly, your body will begin to draw energy from fat to meet its energy needs. Energy is obtained by splitting an adenosine triphosphate or ATP molecule when this happens. When one of ATP's 3 phosphates is expended for energy, it transforms into adenosine diphosphate or ADP. If there are no energy sources available, the ATP is unable to reclaim the phosphate it has given up, resulting in tiredness. Number 5. Headaches. A headache caused by elevated blood glucose usually develops over several days. As a result, the symptoms are frequently delayed. Headaches often accompany hyperglycemia. As your illness worsens, the pain may become more acute. A headache might also be a warning that you need to check your blood sugar if you have a history of hyperglycemia. Hypoglycemia, or low blood glucose, is characterized as blood sugar levels below 70 mg per deciliter. Hypoglycemia symptoms, unlike hyperglycemia, are usually abrupt. As your blood sugar drops, you may get headaches that appear out of nowhere. To treat a headache caused by hypoglycemia, you must first evaluate whether the reason is low blood glucose. Suppose your blood sugar is low due to a blood glucose test. In that case, the American Diabetes Association recommends eating 15 to 20 grams of simple carbs or glucose tablets and monitoring your level again in 15 minutes. Your headache pain may lessen once your blood sugar levels have stabilized. If the pain persists, you may need to take over-the-counter pain relievers. Number 4. Blurry vision. When you have diabetes, your body either doesn't respond to it or doesn't generate insulin, a hormone that transports glucose, blood sugar, to your body's cells. Too much glucose in the bloodstream, outside of the cells where it belongs, can damage blood vessels and nerves throughout the body, including those in the eyes. Diabetic retinopathy is the largest cause of blindness in adults in the United States. It develops when alterations in the retina's blood vessels induce leakage or the formation of abnormal new blood vessels on the retina's surface. Another result of diabetes is the swelling of the eye lens, which causes hazy vision. The shape of your eye's lens can be changed, and your vision can be obscured if your blood sugar levels abruptly move from low to average. When your blood sugar levels settle, your vision returns to normal. Number 3. Dry skin. Skin rashes such as ankylosis nigricans are more common in people with diabetes. Hyperglycemia, high blood sugar, is frequently to blame. A rash might potentially indicate the presence of diabetes. Many diabetes rashes disappear once blood sugar levels are stabilized. Skin disorders that can lead to severe infections can be avoided with proper diabetes treatment and skincare. A skin rash can be the first sign of high blood sugar, hyperglycemia, or prediabetes in persons who don't have diabetes. Your healthcare practitioner can assist you in preventing diabetes. A skin rash could suggest changing your diabetic medications to lower your blood sugar, glucose levels. The reduced blood supply causes other rashes to your extremities, hands and feet. Number 2. Impotence. Erectile dysfunction is connected to other diabetes-related diseases such as high blood pressure and heart disease in men. Individuals with diabetes may experience erectile dysfunction sooner than men without the illness. The inability to maintain an erection may even precede the diagnosis of diabetes. Number 1. Slow healing of cuts and wounds. High blood sugar levels might occur if your body has trouble metabolizing glucose. This can make it difficult for your body to repair wounds. Wounds heal more slowly and progress more quickly in people with diabetes, so it's crucial to know what to watch for. Although cuts, grazes, scratches, and blisters can happen anywhere on the body, they are most common on foot. A little cut on foot can soon become a foot ulcer. If left untreated, foot ulcers can become dangerous. Diabetes causes about 15% of persons to develop foot ulcers. As a result, it's critical to do regular self-checks and keep a close eye on any wounds. The best way to lower your risk of complications is to catch wounds early. These are our top signs of high blood sugar. Let us know what you think about it in the comment section below and share this video with your friends. Subscribe and turn on notifications so you don't miss more interesting health videos and much more. Check out this playlist of latest uploads, and I'll see you in the next video. Take care.